So again, I am Jeff Burkhart. I'm the Executive Director at Literacy Network. We're a nonprofit here locally that has started to do some work on health literacy. And that field is a new field. And we had started this program about 3 years ago in collaboration with hospitals and clinics in our area. So I have a question for you. What do you think the strongest predictor of individual health status is? Is it age, income, education level, employment status, racial or ethnic group, or literacy skills? Any guesses?
Literacy skills.
It's literacy skills, exactly. Why else would I be presenting today? So about 36% of all Americans have low or basic health literacy, meaning that they cannot interpret a healthy weight on a chart. They can't interpret instructions from a doctor on a medical label. And many times, the health system labels these folks as non-compliant when they can't actually understand what's given to them. So the costs of this are between $3.4 and $7.6 billion each year. And in Dane County alone, that's $465 million that's lost to the system because of low health literacy. And some of the causes for that we're going to talk about here. We have causes such as somebody is discharged. They're given an after-visit summary, and they can't understand the instructions, so they don't follow the instructions, non-compliance, and then they are readmitted for that same cause. Those people who have low health literacy are more likely to be readmitted into a hospital. And so what we've done at Literacy Network is we've tried to advance this field by offering an English for Health class, which is a 12-week, 48-hour program for English as a second language learners. All of these classes are taking place at hospitals and clinics here in Madison. So this program covers things like how to take better care of yourself, how to find a doctor, how to use primary care. Many of our clients are uninsured. So how do you get connected with the primary care physician if you don't have insurance? How do you use Access Community Health Center? That sort of thing. So our learners engage in hands-on topics that are very experiential, project-based tasks. So they're learning English at the same time as learning some healthier techniques for interacting with their doctor, their pharmacist, nurse, etc. So they've had a very good experience over the last 3 years. Our learners practice their new language skills in very authentic situations. We actually have a mock clinic where people have to call in and make an appointment, go through the whole routine of a clinic, and then they answer questions about what they need to do for follow-up care in this sort of mock scenario. So it's been very instructive for people. 85% of the learners that we work with have demonstrated improved health outcomes as well as improved English skills. And we've actually also seen that many of our students have demonstrated some increases in knowledge and practical application. And so I'm going to talk to you about some of the actual things that we've been able to do and our students are now able to do as a result. We have a great deal of partners. The Latino Health Council supported us from the beginning when we started this. St. Mary's and GHC financially support our program. And we actually get volunteers from the UW Schools of Pharmacy and Medicine as part of the program to help mentor people. Other partners include Dean, UW Health, Wingra Clinic, and Access Community Health Center, as I mentioned. And we're in our second year of a Humana grant. And we're looking forward in 2013 to making this a national replication model with our partners at Pro-Literacy. And we know that these partners are very essential to the project that we have. So we've worked with these partners very closely to be an integral part of the project. We actually have a nutrition component with the Willie Street Co-op that's been going on now for 3 years, where we have students go to the Willie Street Co-op and learn about nutrition. And so we've learned a bit about partnerships and what a healthy partnership involves. So we know that it's very important that we have the support from the leadership of the organization and that we find mutual benefits. So our learners are learning English while at the hospital is getting out of it some people who are better educated about health issues. And here are some of those. Juana, who was better able to learn from her family. This was the first year that her family got flu shots because she didn't know that flu shots were safe before the class. And so there was some cultural competence that we had to employ to make sure that Juana knew that this was a safe thing for her family. Omar began running once a day, and he started walking more regularly. He also learned that it wasn't safe for him to be measuring medicine, cough medicine, out of just a regular spoon. So he was starting to use real medicine spoons. Amal arrived from Egypt, did not have any background in health issues. She didn't know how to interpret a benefit summary to know who she could see as a doctor, and she became pregnant halfway through the class. And as a result, she started to really talk with her doctor a lot more and advocate for herself. And Berta had a great story of learning about the pharmacy benefits and that she could actually go to the pharmacy and talk to somebody about an over-the-counter drug. And so she did that in English, and she was extraordinarily proud of herself that she was able to interact in English with her pharmacist. So here are some of the next steps with this project. We're very excited about those. Working more on provider education, so we're working with the healthcare system to provide them with plain language information, how to better communicate with people that we work with. Also working with the UW School of Pharmacy and Medicine to better engage with people who we work with. And so if you'd like to learn more about the project, I would be more than happy to talk with you. Here's my contact information. And Beth, who put the program together from its beginning, is also a great contact for you. So thank you all very much.